Well, good morning, and thank you for giving me the opportunity to discuss a simple approach to prolonging your sex span. These are my disclosures. So I'd like to start with some terminology. Many of you in this room know what the concept of lifespan is, the average length of time you're expected to live. Many of you are also familiar with the concept of health span, the portion of your life spent in good health. But today, I'd like to introduce a new concept, your sex span, the portion of your life where you'll have the ability and or desire to engage in satisfying sexual activity. Let me give you some examples. If my lifespan is 81 years old, what I do not want is my health span and my sex span to be less than 81 years. What I want is my lifespan to be as long as my health span and my sex span. In other words, many of us do not just want to live longer. We want our health span and our lifespan to last as long until the day we die. Realize that many of us in this room, we are all in the business of prolonging sex spans. So here's the health span reality. The US lifespan in the United States is 77 years old. Men 75, women 79. If you look at the health span in the United States, it is 67 years old, according to the WHO. According to the CDC, our health span is 62 years old. So you can see the huge discrepancy between our health span and our lifespan. What about the sex span reality? If you look at men and women above the age of 70, 41 to 46% of men and only 16 to 18% of women are still having sex over the age of 70. What about married couples over the age of 70? Only 52% of men and 36% of women continue to have sexual intercourse above the age of 70. Now, there are many factors that are affecting this, but the reality is that our sex span does not last as long as our lifespan. Now, we have to realize that there is a bi-directional relationship between our sex span, our lifespan, and our health span. And if you improve one factor, you can improve the other. For example, if I improve someone's health span, I will improve their sex span and their lifespan. However, I believe that the sex span is one of the best barometers of someone's overall health span and lifespan, and I'd like to give you some examples today. Number one, this is a meta-analysis looking at ED as the ability to predict future cardiovascular events and mortality. Men with ED are much more likely to develop in the future an MI, a stroke, and all-cause mortality. And women are no different. If you look at FSD, especially arousal is associated with an increased risk of cardiovascular events, obesity, diabetes, and metabolic syndrome. And if you look at women with coronary artery disease and you put them through a cardiac rehab program, you see a significant improvement in sexual function in these women, also suggesting a bidirectional relationship. And what about depression? We know that men with ED are much more likely to be depressed. We know that the severity of ED correlates with the severity of depression and anxiety. And we know that if you treat ED in a man, you significantly improve depression and anxiety. And this is one of my favorite studies looking at ED in young men. This is a database looking at almost 2 million men. These are men between the ages of 18 and 40, and all they wanted to do was assess the time to diagnosis of diabetes or prediabetes in these men. In those men who presented with ED, 30% of those men were diagnosed with diabetes or prediabetes on the same day. They had occult diabetes or prediabetes, 30%. And if a man was going to develop diabetes or prediabetes in the future, 75% of these young men were diagnosed within 1 year. Why is that important? Because young men do not seek care. If you look at men below the ages of 40, less than 50% of men below the ages of 40 will go and get their health checked. Let's be realistic. A 27-year-old man's not going to say, let me go get my hemoglobin A1C checked today. 29-year-old man, let me go get my hypertension blood pressure checked today. Young men do not seek care. But if a young man develops ED, he will be in my office the first thing tomorrow morning, right? That's the reality. So ED is an opportunity for us to use as a gateway for screening and improving men's health. And so it is a disservice to take a 29-year-old man who comes to you for ED and just hand him Viagra and send him on his way. Because the reality is he could have diabetes, prediabetes, anxiety, depression, or cardiovascular disease, which we are missing. And we have the first opportunity. So how do we improve our sex span? Well, there's many ways to improve your sex span, but I'm going to give you three ways I think are important. Focus on your partner, lifestyle modification, and focus on your hormones, particularly your testosterone. Sexual dysfunction is a couple's disease. It is not just about the partner sitting across from you in the exam room. It's also about the partner sitting at home. And what affects one partner equally affects the other. The study that had the most profound effect on me when I started my career was this by Dr. Goldstein in 2005. Very simple study. He gave patients Levitra or he gave them placebo. And he said, I'm going to give the female partners at home an FSFI, Female Sexual Function Index questionnaire. I do not want to meet the partner. I don't want to speak to the partner. Just give her the questionnaire. What happened at the end of the study? Those patients who had Levitra had a significant improvement in their sexual function, but the partners at home also had significant improvements in the FSFI questionnaire, all 6 domains. Those men who took placebo did not see improvement in sexual function, and those partners at home did not see an improvement in their sexual function. And the greater the improvements in ED, the greater the improvements they saw in female sexual function scores in the female partners. Let me show you a better example. Dr. Goldstein, again, 2017, giving men, treating them for collagenase, for Peyronie's disease. 189 men, and he had 30 women at home. Everyone got the PDQ for bother, men and women, but the men got the IIEF, and the women got the FSFI questionnaire. What did he find? If you treat men with collagenase, you see an improvement in erectile function, you see an improvement in bother. But how about the female partners? The female partners also saw a significant improvement in bother and a significant improvement in FSFI scores. I want you to stop and take a look at that graph for a second, because I showed that graph to the residents all the time. And I asked the residents, what drug do we give this woman to see such a significant improvement in all 6 domains of the FSFI? Did we give her testosterone? Did we give her AD-E? Because whatever that drug is, I want to give it to every single one of my female patients because it's so profound. That drug was simply treating the male partner. Next, 4 pillars. The 4 pillars of health for me are diet, exercise, sleep, and stress reduction. I don't have a pill on a planet stronger than diet, exercise, sleep, and stress reduction. And each one of these 4 pillars will not only improve a man's sex span, but also his health span and his lifespan. Several examples you've already seen, but this is one of my favorite. So the Mediterranean diet's been commonly described as a diet that significantly improves sexual function. This is a study called the MEDITA trial, looking at 215 men and women newly diagnosed with type 2 diabetes. Primary outcome was change in sexual function. They followed these women for 8 years. What did they find? The decline in sexual function was significantly lower in the Mediterranean diet compared to the low-fat diet. Another study we saw earlier, this is looking at simply aerobic exercise to improve erectile function. 11 randomized controlled trials demonstrating that aerobic exercise alone significantly improves IIEF by an average of 3 points. But the key point from this study was that the more severe the ED, the greater the improvements with exercise on the IIEF. So again, exercise alone significantly improves overall erectile function. And what about sleep? We know that short durations of sleep, less than 6 hours, significantly increase your risk for cardiovascular disease, inflammatory disease, metabolic disease, and erectile dysfunction. Don't forget that the risk of occult sleep apnea in men presenting with ED can be as high as 55%, and long-term CPAP therapy or improving sleep apnea can improve erectile function. And finally, what about your hormones? Now, there are many hormones that are important, but to me, I think testosterone by far is the most important hormone in improving and preserving your sex span. Well, we spent decades looking at 3 variables to improve overall erectile function. What are the 3 areas? We've looked at the cavernosal nerves, we looked at trabecular smooth muscle, we focused on the endothelium. All of our targets have been in these 3 areas. I cannot think of a better drug that focuses on all 3 areas, not only in improving cavernosal nerve, trabecular smooth muscle, endothelium, but preserving all 3 areas as well. What about women? Testosterone plays a critical role in female sexual dysfunction. It's not just only in desire. It has a significant improvement in female arousal and orgasmic function as well. And lastly, I believe that testosterone is the best barometer of a man's overall health. Low testosterone has been implicated in cardiovascular disease, depression, osteoporosis, diabetes, obesity, prostate cancer, and anemia. You show me one other blood test that affects so many other conditions. Testosterone by far is the best barometer of overall health. So in conclusion, sexual dysfunction and low testosterone levels could be the first sign of other underlying major medical conditions. Prolonging your sex span includes focusing on your partner. Keep your partner engaged. Keep your partner healthy if you want to prolong your sex span. Focus on the 4 pillars of health: diet, exercise, sleep, and stress reduction. Focus on your hormones, particularly your testosterone. And finally, remember, improving your sex span can also lead to improvements in your health span and your lifespan. Thank you for your attention.